I saw several questions come through for the dog-caregiver portion, so we can begin with those. One question came from Gareth, and then another Alain, concerning the early virologic responses, specifically among the younger infants. I don't have offhand the median viral load for children less than 6 months. I'm sorry, the question I should say for everyone was, what was the baseline viral load of the younger infants? And what explanations do we have for what seemed to be the persistent low-level viremia in children less than 6 months? So the answer to the first is I don't have it offhand, but anecdotally I can say what we saw resonates with what you see in those data, that the viral loads were indeed higher at baseline in younger infants. And that we saw the slower decline, particularly getting below the level of 50 copies of the younger infants. For many of us, it resonates with clinical experience. And we're going to be looking at this formally as you would expect. Again, in the category of anecdotes, we did not see a lot of dog-caregiver resistance in the study overall, and specifically under the scope. So we are hoping, we don't believe that it's declined to have had that negative response. To the next question. Juliet, are you on?
Yes, I am. I hope you can hear me.
Great. Okay, so let's both monitor the chat for other questions coming through. Another question is whether we looked at the issue of weight gain in our cohort. Of course, we did track weight gain carefully in this, but we have no comparator. So a study is going on now comparing weight gain in P1093 to other cohorts and trials in the network. So we hope to be able to share those data in the coming few months to about a year. And I know that the Odyssey trial is also, of course, looking at this separately and will be well positioned to answer this question, given its design. So that is Dr. Singh joining us now. Questions for him. I just have a question from Ellen to me about whether we have PK data to suggest poor adherence with the patients that did not suppress. So the answer is, in a few cases, that was clear, but the study design is to check the PK exposures, intensive PK within the first month, and then just a few focus time points for sparse PK later. So we don't have a lot of contemporaneous exposures. At the time, a number of children weren't suppressing out within the 6 month window. So in some cases we were able to, in other cases it was less good. So I believe we have 5 more minutes, but we're not seeing more questions come through. So please let us know if you do, and we'll try to get that online.